guys. All right, this is our second installment of pregnancy series with Dr. Poole. We are going to discuss second trimester things this time. I am currently 20 weeks pregnant, so right kind of in the middle of that second trimester. What a blissful trimester it is. So at least for me, if you watch my trimester 1, it was not so blissful. I'm feeling much better. We'll talk a little bit about diet and things like that too, that changes with my second trimester. But I just want to start this one off with talking a little bit more of why I think these discussions are so important while you're pregnant. I think one of the most common things I hear, and with such a large population of moms as my patients, the thing I hear so much is, well, kids come first, so mom comes second. I know how true that is for so many of us. When our life revolves around our kids, it is really hard to prioritize our own needs. But when we are pregnant, self-care is childcare, if that makes sense. We are the home of that baby. Our womb is the home and the very start of this child's life. So it is the most important time for you to prioritize your own health, because it so directly affects, not that it doesn't for your older children too, but this time around so directly affects the baby that is in you. So self-care is childcare. So if that's a motivation as to why we should take all of this really seriously, hopefully that helps some of our mom brains restructure this a little bit. One of the things I want to talk about, because it's the most common thing we see, is pregnancy gingivitis. You may have heard that before. I know everyone's heard of gingivitis, and this is a little different than just your standard gingivitis, is because it's given its own name because it is affected by hormones. So someone who may not have gingivitis normally can get it during pregnancy. And I say that because a lot of times even our most diligent home care patients doing all the right things will still have gingivitis while they're pregnant. Gingivitis is just the presence of inflammation of the gums. Part of this is due to the excessive amount of blood that our bodies produce while we're pregnant. The hormones playing a factor in that pH, so more acidity is going to be more inflammation in the mouth. And those things play a huge factor into why our gums get a little more puffy. The puffier our gums get, the more likely they are to collect some plaque and bacteria. And so it just makes our threshold for keeping things clean a little bit harder, a little bit more. So we do have to up our home care a little bit more while we're pregnant for that reason. If you are a victim of pregnancy gingivitis, it is certainly something we will talk about at your cleaning. It's something your hygienist will note right away and talk to you about. And talk to you about ways to combat it. And some of it is sometimes just dealing with it. With my first pregnancy, between 2 teeth, I bled every day, every time I flossed, no matter what I did. And it just happens. So we definitely just want to make sure there is no bad bacteria present causing that area to be more inflamed or causing your body to deal with inflammation. So all that to be said, a lot of times when we diagnose pregnancy gingivitis, we recommend more frequent cleanings. Every now and then I get a patient who says that their OB tells them to get less frequent cleanings or not get their teeth cleaned while they're pregnant. I've never had that confirmed by an OB or midwife or anyone saying that that is true for their patient population. Even their most high-risk patients, they usually recommend frequent cleanings. And that's because they're aware of pregnancy gingivitis and wanting to make sure that their patients are taking good care of their oral health during pregnancy. So all that to be said, we have a lot of patients that will up their visits to us just to get their teeth cleaned more frequently during that time. That being said, the one thing we do like to hold back on a little bit is dental procedures in general. So if you do need fillings, crowns, things like that, any sort of dental intervention, there are some that we don't like doing during pregnancy, especially elective treatments. We are going to try to hold off on those. If we do need to do something because the inflammation or risk outweighs the benefit of waiting, those are something that we'll discuss with you and get a letter from your OB or midwife to make sure that you're cleared for treatment for that. the sweet spot is the second trimester, so that's why I want to bring it up now. This is our lowest risk portion of pregnancy. That first trimester is a really fragile state, and then the third trimester is a state where we worry about putting too much stress on the mom, that could cause some preterm labor issues. So second trimester is when most practitioners, OBs, midwives, and dentists would prefer to do work on a pregnant mom. So if we do have to do it, it's not the end of the world. We certainly want to weigh those risks versus benefits for each patient and decide on things like that. But all that to be said, if you know you have work done, you're in the second trimester and are interested, it's something you should talk to your dentist about. And that can be a decision you guys make together. There are some interesting statistics about mothers with untreated cavities and the likelihood that their child will then have more susceptibility to cavities once they have teeth. And that statistic is 3 times more likely. So if you are pregnant and have untreated cavities, the idea behind this statistic is that the bacteria that populate your mouth and have helped cause those cavities can cross the placental barrier, can get to baby, and then if they are automatically populated with that bacteria already, once their teeth erupt, they would be at higher risk of getting decay. I think there's a lot of statistics that go into that. I don't think that that's necessarily true all the time. I think a part of that is just that mindful mouth. A mom who takes good care of oral health is going to pass that down to a child as well. So there's a lot of different factors there. Just found that to be an interesting fact to share. On that note, I do want to talk about all the things we can do to help be proactive and preventative. And some of the things that we could do during pregnancy is pH testing. So we can do that in our office. You can even do it at home. I mean, getting your own pH strips, there's a lot of nuances there, and you can look online, but like not eating and drinking for 2 hours and things like that before testing. But we can guide you through that in our office too. Just understanding where is your normal baseline of acidity level in your mouth can really help you consider how frequently you're eating, what you're eating, alkaline water, things like that. Just being more aware of what's going on in your mouth can be really helpful. On that note, the other tool we love so much is microbiome testing. That one can check for these bacteria that can be passed down that are cavity-causing bacteria. They can test for gingivitis bacteria, things like that. And our favorite little microbiome test kit from Bristle Health, which we've mentioned before, also has suggestions. So when you get yours back, it will tell you things that you can do. It's also something you can share directly with your dentist to let them know what you're monitoring and what changes they need to be talking to you about as well. So those are just 2 really great tools, I think, to be extra preventative during this time. And then supplements. I know I mentioned during first trimester that I was taking supplements. I think I mentioned that I was taking vitamin D3 and K2, which is just generally a good supplement that I recommend for teeth in general, and then calcium as well. I take a lot of supplements. During pregnancy, it's twice as much as usual. I am so weary to give people supplement recommendations for a lot of reasons. And that's just because I stand by our policy in my office, which is all of us are so unique. And I luckily know a lot about what my deficiencies are and what my body needs extra care with. And so I know what supplements I should be taking, and I get blood work done after I take them so that I can understand if they are absorbing well and all of those things. So I really recommend knowing your own and talking to your physician about supplements, especially while pregnant. I am not going to be recommending you take all of these things without talking to your OB, midwife, physician, whoever, and someone who really understands what your specific needs are. That being said, I still like to share what I think is helpful for oral health. And one of the things that I really up is my probiotic, especially dental probiotic, so a chewable probiotic during pregnancy. The one that I love the most is by Super Teeth. It is a great dental probiotic brand. So it is one that I am taking more of during this time. when we talk about pregnancy and all the changes that occur in our body, we're basically talking about and changing the entire environment. I mean, if we are off skew with our acidity levels just by a little bit, it's going to change the type of bugs that can thrive in our body and all of those things. So it's really important to me that I have good bugs in my body. So I want to really populate with good oral bacteria to prevent things like cavities. I know I've mentioned it before, but we are at higher risk of getting cavities during this life phase. So it is something that's really, I'm trying to throw a lot of things at to make sure that I'm not going to be at risk of that. I'm not sure if I shared in the first trimester video, but that wives' tale of you lose a tooth per child. It's something that I mention in the office a lot because a lot of people bring it to my attention. And you're not going to lose a tooth, not on my watch. My hope is that with extra tips, tricks, and care with your dentist or us, that we're not even going to let you lose mineral density of your teeth, let alone lose a tooth during a pregnancy. So the reason there's something behind that statistic is because we are higher risk of these dental issues. Probiotics are such an important factor of good, healthy microbiome, rebalancing it while we're combating some of these things like acidity during pregnancy. I'm going to talk a little bit more in the third trimester series chat about the importance of the bacteria that lives in our body, kind of when it comes to like your birth plan as well, because this is going to be such an important thing that is transferred to baby. The last thing I just kind of wanted to talk about or touch on was nutrition and frequency of eating. And that's something we've talked a lot about in oral health in general, especially during pregnancy, because I don't know about other pregnant mommies, but I eat so much more frequent when I'm pregnant. I'm hungry every 2 hours. Many of you, I think, have experienced this as well. If you don't eat, it's not good. So that is not a lot of rest time for our mouth, which means that's when that pH stays low, the bacteria are thriving, they're being fed all the time. So we want to make sure they're being fed good things, keeping the probiotics high. I also use a collagen protein by Needed, which is a great prenatal protein. So I add that to my coffee or tea in the morning and generally just try to up my protein as much as possible. That's not only good for baby health, but it is good for oral health as well. If any of you are interested in kind of continuous glucose monitors or checking your blood sugar, we know that protein is the best way to regulate blood sugar, but that also can stand for oral sugars as well. So making sure that we have balanced meals and that every meal has a bit of protein in it can kind of help the sugar acidity or not overfeeding the bugs in our mouth with carbohydrates or sugar. So high protein meals, and I still eat really close to bedtime, which is not a good recommendation for health in general, but it is something that as a pregnant human I am doing. So I typically have highest protein snack at bedtime, and really try to make it as minimal in the sugar department as possible, mostly because feeding the bugs in our mouth sugar right before bed is when we're going to see the lowest drop in our acidity while we are sleeping. It's also when our mouth gets the driest, so the washing off of saliva is at its lowest. So that overnight biome, everything that's happening in your mouth overnight, is the most essential time to keep it as cavity free as possible, or keeping those bugs as healthy as possible. So high protein, low sugar is my nighttime snack. All this to be said, I think it's just the last thing I would say about this trimester is it's time to start planning ahead with your due date approaching. Start considering and making sure that you're going to see us maybe before baby gets here. If you are going to be due right after baby gets here, we're going to go ahead and assume that might not feel super doable to mom to come immediately after you've had a baby to get your teeth cleaned, which by all means you can, and bring that baby to our office because we love seeing them. But that to be said, I just always like to tell moms in this time, like, okay, let's plan ahead. If your 6 months visit is like immediately after baby is here, we could see you before. I always like to do a new mom chat before baby gets here of just like your care and sleep cycle, and everything is going to change in that 4th trimester time. So there are some more things that we just chat about when that time comes. So I typically like to see you before baby if we can, to talk about some of that. So that's it for my 2nd trimester talk. And we'll talk again in 3rd trimester.